It's Rob Bonta, California Attorney General. Thank you for including me in today's event and for doing your part to spread awareness about elder abuse. I want to give a special shout out to Kelly Dearman, the Executive Director of San Francisco Department of Disability and Aging Services, and the Institute on Aging Elder Abuse Prevention Program for their work on this event and for their ongoing dedication to our aging community. At California DOJ, we're committed to fighting against all types of elder abuse and neglect. Elder abuse is a national issue that threatens some of the most vulnerable members of our communities. In fact, every year, at least 10% of adults 65 and older will be a victim of it. And that only accounts for the cases we know about. Too often, these vulnerable adults suffer in silence. It's up to all of us, and especially those involved in their care, to protect them against harm and ensure they get the comfort and dignity they deserve as they age. That includes preventing isolation. Because in addition to the serious emotional and mental impacts of loneliness, isolation puts older and disabled adults at a higher risk of neglect, exploitation, and abuse. Isolation is not a given. We can and must prevent it. We can raise awareness, like you are today. We can invest in prevention, and we can strengthen our support systems, all of which will help prevent isolation and prevent elder abuse before it can take root. We can't just react when we learn abuse is happening. We need to do more to prevent it from starting. It starts with making sure no one is forgotten. Social workers and service providers are on the front lines of this effort. They bring more than just services. They bring compassion and trust, building relationships that protect people from harm. Their skills, knowledge, and commitment keep older and disabled adults connected, supported, and safe. Their work is invaluable, and I thank them for it. The truth is, we all have a role to play. To check in on aging and disabled loved ones, to speak up when something's not right, to support good care providers, and to build systems that care. When we do, we'll build a brighter tomorrow where our most vulnerable communities are protected and cared for with love and dignity. Thank you again to everyone watching today. Your dedication to ending isolation and eradicating elder abuse will change lives. Please know you've got a partner in me and everyone in DOJ's Division of Medi-Cal Fraud and Elder Abuse. We're here to support you.
With that, we're going to turn it over to Achilles Saron from the San Francisco Adult Protective Services Program.
Hello, my name is Achilles Saron. I am the San Francisco Adult Protective Services Program Director, a program of the city's Department of Disability and Aging Services. I'm honored to be here today at this valuable webinar. I want to thank Chiu and her team at the San Francisco Institute on Aging. Every year, they do such an amazing job organizing and running our city's World Elder Abuse Awareness Month activities and training. The Institute on Aging's Elder Abuse Prevention Program has trained so many folks in our community and have helped countless older adults across our city with anti-scam training and important webinars for professionals. We are so grateful for their expertise and help with this vitally important issue. Today's webinar is focused on reducing social isolation to lower the risk for abuse of older adults and adults with disabilities. We know that when we help reduce social isolation, we effectively help reduce the risk of abuse. Every day at the San Francisco Adult Protective Services Program, we see the impact that social isolation has as a risk factor for abuse, neglect, self-neglect, and exploitation. We know that the less socially isolated older adults and adults with disabilities are, the less likely they are to fall for scams, and the more likely they are to report abuse. And the more connected they are with our community, the more engaged and more likely to thrive while aging in place they are. Thank you, and please enjoy this webinar. Sarah?
Great, thank you. And with that, I'm going to turn it over to Chiu, the lead supervisor of consultative services with the Elder Abuse Prevention Program at the Institute on Aging.
Hello, everyone. My name is Ali Chiu. I go by she, her, hers. I am, like Sarah and Achilles says, I am from Institute on Aging. And thank you so much, AG Banta, for giving us this amazing introduction. And thank you so much for Achilles. We cannot do this work without Achilles and the team at APS. We cannot do this work without you all here today. So I really want to say thank you so much for having us here in the webinar. Before I introduce myself, I wanted to just maybe ask who's here today? Sarah, if you could put the poll up and let's just, if you could just let us know how are you involved with, what field are you in? How are you involved with older adult and adult with disabilities? To give people a couple of minutes, a couple of seconds. And Sarah, whenever you feel like it's time, we can just close yeah.
Sure, we're winding down. I'll just give it a couple more seconds.
Yeah, thank you.
All right, I'm going to end it in 3, 2, 1. All right, so it looks like the majority of folks, almost half, are with social work and case management. We've got some folks from legal aid and law, some folks from law enforcement, fiduciary, public health, victim advocates, medical and psychology, all at about 5 to 6%. And then about a quarter of the folks are other.
That is amazing. Thank you so much, everyone, for being here and letting me know who you are. And so on the screen, you see my picture. I am a light-skinned Chinese woman from Taiwan, hence my accent. And I think I'm wearing a red shirt, and I think I have flower, holding a flower in my hand. And that's the picture somebody took of me at the former district attorney's office. And so my background is really, I've been doing work in the field of nonprofit since 1999, mostly around domestic violence, anti-violent work, sexual assault, and human trafficking. I've worked at Senior Disability Action in the past, doing some advocacy work for older adult and adult with disabilities, and and sitting on some committees. Right now, I am volunteering with the National Human Trafficking and Disabilities Working Group as a member. I'm not a steering committee member anymore, but just really volunteering with them and done a lot of different education and prevention stuff with them. I used to volunteer on the Friendship Line, shout out to Friendship Line, and which we'll cover a little bit later today. So that's my background. I've done a lot of direct service work, and a lot of you on the computer here we have cross paths in the past. So let's go to and we have Annette moving our slide today. Thank you so much, Annette. And like Sarah said, I use assistive technology. That's why my video is not on. I'm listening to my PowerPoint when I'm presenting. So this is the accessible way I'm doing it. So sorry you're not seeing my face, but we're going to see the content on the screen. So let's go to the training goals. So today we're really here to kind of learn different type of isolation. I kind of put it together with input with my team, and we're going to kind of dissect a little bit about isolation. We hear the word social isolation, of abuse.
Pardon me, Allie, I just want to interrupt.
Yes.
Annette, can you go to the training goals slide? There we go.
Okay. Oh, yeah. Sorry about that. Thank you.
Yep.
Yeah. Yeah. And the last one on your screen is really for us to explore those tools and resources to support, Support folks who might be experiencing isolation, and to make sure that we do that so we can lower the risk of elder abuse. And that's the title we have today. It's really kind of like, okay, what's the issue here, and how do we connect the dots and prevent elder abuse? And that's really what we're here to do. So I hope you are in the right webinar. Annette, let's go to a next slide when we see the definition of isolation for older adults and adults with disabilities. So again, I put this definition together. It may not be something that you can Google, an AI can come up, spit out something different, but this is something I put together myself. It's not very conventional, but I really like it. Isolation for older adult and adult with disability is defined as barrier for safety, self-care, socialization, mobility, and independence. Right? I really see that as a barrier, as someone who is a person with disability, as someone who, volunteer on the older warm line. I really see that a lot. The isolation really is a barrier for all these elements, right? Isolation is one of the main tools abuser and scammer use against older and disabled adult, right? And we'll get into that in just a tiny bit. And as some of you have attended our mandated reporter training, we talk a lot about that, right? As a tool, right? Our abuser, the scammer, don't kill anyone, don't, and don't do this, don't do that, right? They use isolation as a tool. So we're going to talk about a little bit. Isolation take different form. And it's really, here I really wanted to emphasize, it really effectively, negatively across this population, right? It's really, really important that when we talk about these populations, including myself, we have to take race, disability, indigenous population, socioeconomic status, immigration status, LGBTQ status, and different rural community into consideration when we are talking about this issue, right? It's not our identity and our demographic, it's really complex, right? Like I'm a blind person, right? I'm also a Chinese person. I'm a mother. So we have different way of kind of defining ourselves. And those are really, really important when we are talking about abuse and different situation, right? So I just really wanted to bring that up. So let's go into it. And then if you could go to the next slide where it says social isolation, right? And social isolation for me, I really, and my team, we wanted to really kind of put it out there. The first thing we see is lack of accessible and affordable resources and services, right? And what do I mean by that, right? When people are not able to have accessible technology, they are isolated. When they don't have affordable and accessible transportation, they're isolated. And I can give an example. For example, like, we get on the internet, we do a social media and things like that. So, right. So when, for example, older adults don't have the skills or or people with disability don't have accessible tool to go on social media, we're isolated. I'm someone who use a screen reader, for example, and some of the content are not screen reader friendly. So I'm missing out with important and critical information a lot of times, right? And I did it an outreach presentation with Lighthouse for the Blind in April, and a lot of people share that with me. They go, yeah, when we are being scammed, when things pop up on the computer, right, and then it says click here, you can get out of it, whatever. That part, the screen reader doesn't read, so I don't know what's going on the screen. And so if we accidentally click on it or tap to it, right, we might put our computer in the very dangerous space, right? So that's what I meant by that social isolation, because we don't have access, right? Language access is not a big thing as social isolation. When people, when we are not providing services, we're not providing support with language access, that's a big barrier, right? For healthcare and stuff like that. Neglect by others, right? And that's a big thing when we talk about elder abuse and abuse against dependent adult, right? Neglect by other is a big thing. Dependence on others for care. And neglect equal isolation, right? And that's kind of what I have for myself. It's a note is that, when someone who has to depend on someone else to care, to get them out of bed, to get them say that someone needs someone to help them get them out of the bed so they can get to work on time. They can go to social gathering on time and stuff like that, right? When that doesn't happen, what happened? They're isolated, right? So a lot of time that we don't think about that. We don't think about that kind of thing. We can go places. A lot of us can go places, stuff like that. Have we ever thought about, when we have to, take elevator into consideration, right? We can just take the bar, go to Oakland, go to Berkeley, do whatever we do, right? But what if you are a wheelchair user? What if you have to make sure that which bar stations elevators go down? So you have to plan your route. Do you get up at Power, take the bus and transfer to this place and that place, right? Extra trip, extra time. But when you don't have someone who can get you out of the door on time, and when you have elevator issues, right? Those are barriers. Those are barriers. Those are neglect by society, neglect by others, right? Self-neglect, that's a big thing we talk about in our elder abuse prevention training, is really those availability of support and services really could contribute to that self-neglect space, right? If someone who's unable to take care for themselves because of cognitive issue, a different issue, that's one thing, right? And they will be isolated. But on top of that, they may not be services and support out there to support folks, right? So that could be an area that we need to kind of think about. What does that mean? What does that look like for us? Okay, let's go to the next slide. And then when we see mobility isolation, and I I name all these different things because I think that it's easier for my brain to kind of like put them together for this PowerPoint, and I hope that is working for you. So lack of mobility access it's a really way it's a way to for people to feel isolated, people feel like there's a barrier, right? And again, kind of like what I talked about earlier, if you have to rely on all this access and elevator for me is really technology access, right? And also for me, sometimes I don't go to big event because I'm sensitive to scent, right? And so if you have an event and it's not scent free, I get sick, and sometimes I have to be sick for a few days after the event because of the scent, not having the scent free thing. So when we don't make meetings and event accessible, we're creating isolation, we're creating barrier for folks, right? Lack of communication access, right? That's very, very straightforward. We did the in-person World Elder Abuse event last week, and we wanted to really make sure that we have language access. So we had an interpreter for ASL interpretation. And so we really want to make sure that when we are providing support for folks, we need to kind of consider and check in with folks. What do we need? What can we do to really eliminate isolation and eliminate barriers, right? And the next one is increased disability, right? And that's a really, really, really big one for older adults, especially, right? Especially in people with disabilities, right? And one of the duty I have as a job is I supervise some staff who work at different independent buildings, Mercy Housing, MLT, Martin Luther Tower, right? And the thing that a lot of people come and it's like, how do I navigate my life now that I'm losing my vision? And that's a really big isolation point there. How do I navigate myself? How do I even talk about it not? So a lot of people, and when we talk about when we have training on disability and ableism, we usually talk about ableism, right? And a lot of us have ageism, ableism in us, right? I hear that from people. People will try to fake it, pretend that they can see better than they can, and they don't want to admit that they are. My mother is doing this right now, right? She's losing her vision, and she's, oh no, I can see, I can do it, and she doesn't know what she's saying. Or people will pretend they understand what you're saying, and it's one way to really, one, not wanting to admit that losing their hearing. Two is like they're really trying to say, okay, let me do better. And it's really from the root of ableism, right? And being disabled is a bad thing. being a disabled is a bad thing for a lot of people. That's what they have in their mind. So, and I actually hear, you know, a lot of older adults say that to me, you know, well, I'm old, at least I'm not disabled, right? And that's a big, big thing about this ableism way of looking at things, right? So accepting and understanding losing and increasing disability, losing ability and increasing disability is a big, big factor for isolation, right? They don't want to go out. I actually I have a neighbor, you know, she's in her early 90s and she does not want to go out because you know why? Because she told me she doesn't want to go out for people to see her using a walker. Right. And that's therefore she further isolate herself because of that. Right. So people could have mental health disability and they have cognitive impairment, dementia, and different thing, right? People don't want to say, you know, another friend, you know, I say, you know, we talk about this, you had this appointment. She goes, I'm 91, I'm not senile, right? That's what she told me, right? So it's really, really hard for us to kind of really accept that we might have a disability and to kind of both grieve and also find ways to talk about it with other, you know what, I am losing my vision. What do I do? And how do I, you know, how do I cope with this? And how do I get support? And so I really wanted to bring this up as a form of mobility isolation is because, you know, it's a big element of aging. It's a big element for every one of us, for every one of us. Yeah. All right. So let's go to a next slide when we see financial isolation, right? Again, I put it this way because I wanted to put it out there. It's not just our abuser, scammer using financial exploitation to control us. It's also us not having access to it, right? So the first one I have here is financial exploitation, right? That's a big thing when either through financial abuse or benefit trafficking, right? People could use, you know, use our income and control us, you know, either traffic us, make us do things, or not letting us have those our financial access. Yeah. Oh my God, I had coffee earlier, so I'm a little jittery on top of being a little nervous. Financial scam, that's the next one, right? Um, you know, one thing, you know, it's for us to be experiencing being scammed. The other thing is also the feeling, the shame of being scammed. Excuse me. And how do we talk about our shame to other people? So that's a really big factor of isolating. You feel isolated because you don't know how to talk to other people about it, right? I'm so stupid. How can I, right? So we tend to blame ourselves, you know, for the horrible stuff that scammer does to us, right? Scammer do to us, right? So, you know, so that big feeling of shame, you know, really we will further isolate ourselves because of that, right? And then, you know, a lot of time it's like, okay, not just shame. Well, now I don't have enough money to get grocery. I don't have enough money to pay my rent. How do I get help? You know, nobody wanted to ask for help. You know, it's so hard. It's so hard for people to ask for help. I have a friend who fell down the stair and she's in a sniff right now. And, you know, we're trying to see if we can support the partner and the community is trying to step in. And I kept saying, you know, ask for help, reach out. And the partner who's, you know, not the one is in the sniff, that the one who's helping, she's like, I'm trying. It's really hard to ask for help. So again, when we don't have the tool and support and we don't have, you know, like, how do I ask for help? Right? It's kind of like a shameful. It's a rooted. And again, when we have a webinar to talk about disability and ableism, we'll talk more about that, right? Because of capitalism, because of all this factor, you know, we have to be strong. We have to be independent. So asking for help, no, we don't do that, right? So we're taught not to ask for help, right? The next thing is lack of access to finance and benefit. I already talked about that, right? Lack of employment opportunities. That's another thing, right? When we don't have a good way to get employment, we meaning older adult, adult with disability, and you see a lot of discriminative hiring and retention practices, right? A lot of time, like when I was younger, right? When I was younger, when looking for job on Craigslist, and a lot of job you will see, when they look for case management, they say you must have a valid California driver's license. I'm thinking, well, I don't qualify, but I have years of case management experience. So what do I do? Right? I don't apply for those jobs. That's just one little example. There's a lot of example you will see once you pay attention to those hiring practice, you can see, wow, that there's a lot of discrimination in those language. And there's a lot of discrimination towards older adult and adult with disability. So how do we have those employment opportunity, right? And that's gonna make us more isolated because I felt like I had nobody to talk to when I was experiencing that, right? Lack of equal pay, employment, again, I see that a lot. When I was doing a lot of work with human trafficking, I see that, they put it out like legit, like a nonprofit, they're paying older adult with disability with gift cards and really little tiny gift card. And that kind of go back to the root of talking about shelter workshop, right? Like people with disability are not paid minimum wage, right? And we still see that. We still see that. So how do we have equitable society when we still have legal practice like that? And that's going to further isolate people, right? Because again, these are others, right? These are others. The population we're talking about are the others. They are the vulnerable population. They are not us. So let's see how we can, quote, help them, right? And that's what I'm going to get into a little bit in a minute. Let's go into the next slide when we see relationship isolation. And here is really what I'm going to talk about. A lot of time when people are experiencing abuse, right? And when they are in an abusive relationship, in a situation when they are being abused, either through their partner, intimate partner, right, or gender-based violence, right, or their children, right, they are isolated. They're isolated. And here on your screen, you're going to see different bullet point I have, right? When you don't have opportunity, right? When you don't have opportunity to tell other people about it, if you're willing to tell other people you're being abused, right? You're gonna feel isolated. You're gonna feel so lonely, right? A lot of time we use the word loneliness and isolation interchangeably. They are actually a little bit different. But here I'm gonna just focus on the word isolation, right? We're isolated because we don't have a way to tell other people, right? And abuser use disability and our LGBT status, our immigration status, our pet, our family member to control us. We are isolated because of that, right? We are isolated because the relationship is not working and we don't have a way to tell other people. One big thing here I have the relationship isolation is loss of loved ones, right? And everybody's gonna lose someone in their life. We will, right? But the big issue here is we don't have the tools and resources to grieve. I was telling Sarah a little bit ago, I went to a talk to see Isabel Allende last night, and she talks a lot about how she grieved her daughter when her daughter passed away, right? And through writing, how many of us have the right tool and resources to grieve those loved ones, right? Do we have family members around? Do we have a support group with folks accessible for people with disability and language access for people to join the support group? Right? Do we have money, enough money to go to the support group, transportation? Do we have money to cook, right food to nourish our soul and our body, right? So that's really, really a big thing, right? And we don't know how to talk to other people when we don't have the tool to grieve, right? And that's a big thing, losing someone. And I have a lot of friends who are in their 80s and 90s, right? And they say, Ali, when you get old, you'll know because everybody gonna be dying, right? And we already know that, right? There are different ways we're grieving for that loss, and losing loved one is a big thing that we gotta make sure that people have and tool to grieve and to be able to communicate that grief, right? The last one I have here is lack of lack of opportunity to communicate that trauma and abuse. Again, we talk a little bit about it. Is abuser using isolation, using this as a tool to control us. Right? We don't have a way to communicate with others, and also we don't have a way to process this information because we're isolated, we're gaslighted. Right? So many times, actually, one of my staff was telling me that um, somebody in the building, his partner is abusing him, and every time APS is called, police is called, no, everything's fine, and he's like totally clearly being beat up, but he's not able to let folks know that he's experiencing abuse, right? And that could be because the abuser is using isolation tactic. Abuser could use different things, right? Like I said earlier, could use your LGBT status, could use drug to control you, right? So those are really, really important things to kind of really think about. How do we support folks, right? All right, so let's go to the next slide. I'm going moving the slide along. Oppression isolation. And this is really when I'm going to be kind of talking a little bit. I touch on the disability and ableism a little bit. And one of the things is not just ableism, but ageism, right? And that's the thing that a lot of us don't talk about, right? We see it, we hear it, and people spend millions of dollars, trying to look younger, trying to look healthier. They have plastic surgery and this and that, right? So one of the way that people are experiencing isolation is oppression, right? Oppression, isolation. This is a system issue, right? History of erasing, discriminating, dismissing, and overlooking, and discrediting, for example, right? How many times have we heard that? Have we say that as a support person or a social worker or whoever we are, right? Well, Betty, she's got dementia, so we're not sure whatever she's telling us is true, right? And sometimes we'll catch ourselves saying things like that, right? And many times I would call the police for a situation that I experienced, and police, the first thing the police would ask me, not what happened, not who is around me. The first thing they will ask me is, how much can you see? Because the fact is that, it depends, right? Depend upon my credibility, well, how much do I say? What do I say, right? So that's a big factor. It's like we're not credible witnesses for a lot of things. We're discriminated against when we are experiencing different things. We're being raised, and think about the history of the medical model approach in our society here in the US, right? And what I meant by medical model is a practice where we as able-bodied, we as young people decide for others, right? And so we have the eugenic movement, we had the ugly law, we have all these different situations, right? So we decide, you know what, this person has an intellectual disability. We can decide where they should live, what kind of education they should receive. We can decide. We should decide. Do they get sex education or not? So that's what we call the medical model. So when we are in the medical model society, right? All these things come in, right? We feel isolated because nobody wants to hear us. Nobody cared about us, kind of thing, right? So and same for the older adult, right? This person's old. I actually say that a couple of days ago when I did the training, right? I worked with this person on the friendship line, and she was 93 when I was talking to her, and she always say, "Oh." I go by May at that time on the volunteer and said, May, this Kaiser nurse come in, and and I live by myself, and she kept calling me, I'm a frail individual. I'm a frail individual. I'm not frail. What is she talking about? Right? So we kind of start thinking, oh, okay. So when we're trying to kind of categorize people, label people, People feel isolated. It's important to know that, the effect of our word and our action, people feel isolated. This history of discrimination, again, not having that trust for government, right? So if I have a history of discrimination, I'm not gonna trust you gonna be able to help me, right? Because I already have that experience, right? I'm not gonna call out. I'm not gonna tell you if I'm experiencing abuse and trauma. I'm not gonna tell you because I don't think you're gonna help me, right? So that's an isolation right there, and that put people in vulnerable state. We call older adult and adult with disability a vulnerable populations, right? But we have to understand that a lot of times society put this population into this vulnerable state. A lot of us, we have to take responsibility, right? Including myself, right? So those are things I really wanted to kind of put together and get us kind of think about different type of isolation, and for to say, wow, there's a lot that Ali is saying, and a lot of this, actually all of this, it's not new to you. You know all this already. So let's go to the next slide when we're going to connect the dots. We're going to look at some information and connect the dots, right? All right. So what you have on your screen is some bullet point we put together. The first thing is really aware of that overwhelming feeling, right? Overwhelming feeling of it could be a living situation, right? If someone is awareness of awareness of overwhelmed feeling or living situation, right? When someone is isolated through all these different type of isolation, right? They feel overwhelmed. They feel overwhelmed, right? So that's one thing to really think about. No one, and people can think, okay, no one seems to care about me, right? And like I say before, right? When people are experiencing abuse, for example, they can say, well, no one give a, about me, right? When someone keep calling, for example, that example I just gave, right? The neighbor is calling because her neighbors the guy is beating up this other guy, and he doesn't feel like it, and this other neighbor, she's feeling isolated because she kept calling the police. He kept saying nothing's wrong, APS come, nothing's wrong. And so a lot of times people are like, oh, nobody's doing anything. Nobody care. Why should I say anything? Nobody care, right? They can feel that way. It doesn't mean it's true, right? But it could be, people could feel that way, right? The feeling of shame, right? The feeling of overwhelm, right? It's unable to people are unable to do things, right? To complete a task or to help, right? People are used to do things, but now they are not able to do. Sorry, my screen. So people are feeling overwhelmed and really kind of feel like, what do I do? I used to be able to do this. I'm upset. I can't remember things. I'm upset. This is so upsetting, right? So people feel isolated because they, again, have a hard time grieving and dealing with the loss of disability, the loss of mobility, the loss of memory, right? So actually, I have a friend, she told me that, Ali, when I can't remember anything, just put me away, just put me out of my misery, right? I actually have a friend, and she was joking with me about it, and I'm her medical director person, right? And I say, well, let's talk about what you want to do when that happens, right? Let's talk about what you want to do when that happens, because it's really frustrating, right? And please, folks, please do not say I'm having a senior moment, because that's so ageist, right? Everybody forget things. But when we are forgetting things, that's really frustrating, right? Not knowing when and how to reach out, right? When we are having increased disability. I already talked about that, right? Do I talk to my doctor about it? Do I talk to my neighbor about it? What do I do when I used to be able to walk 10 miles a day? Now I can't do this, right? And that's just an extreme example, but I'm sorry. So having the increased disability is a big thing, and like I say, a lot of time that people feel, overwhelmed of not having that control, right? Not having that control of their memory and that independence, right? Here I wanted to really point out that, independent, it's really one way to look at the world, right? But it's kind of, again, looking at ableist way of like, okay, we have to be independent, we can't ask for help, we can do all this by ourselves, right? And the feeling is there. We wanted to validate people's feeling, but we also wanted to make sure that we understand that the way of living, that interdependence way of living, we wanted to find way to have that interdependence there, right? So to support each other, right? The next bullet point is feeling powerless, right? Of lost control and when in that relationship, right? And that's really lonely, right? Not having power, not having control, right? And again, feeling nobody, the feeling of nobody understand and nobody cares, right? So those are the dots I wanted to connect. It's like, you see all this isolation. Now we kind of talk about how people feel about all this isolation is doing to them, right? So what do we do? What do we do? Let's go to the next slide. I have titled Breaking the Ice. Breaking the ice, right? We learn about the different type of isolation. We learn about how people feel about it, right? And we learn about what people, face, discrimination and the oppression and mobility and the grief, right? For us to break the ice, the first thing is to listen. Ask how we can support, right? Rather than making assumption of what people need, right? Oftentimes, in the example last night, this is just a very simple example, but it over time it gets a little frustrating, right? Like last night, I walked into this hall. I was with two friends, and the people who were leading the way basically just grabbed my arm and say, "Okay, let's just go this way." Right. And although I don't usually mind people grabbing my arm, but it could be a little scary when you don't know people are touching you. Right. So that's a very, very simple thing. Right. If people who are using a walker, when you grab them, they can fall. Right. And that's one thing to, make an assumption. Right. We make assumption of what we think that people need. Right. So my big thing here is listen and ask questions. Right. What can I do for you? How can I support you? And their answer to your question may not be what you want to hear, right? And so do we ignore them, or do we just say, well, you know what? I hear you, but I think I have a better solution for you, right? So a lot of time we do that. We do that, including myself. I've done that. I've done that too, right? So we wanted to make sure that we are not further isolating folks. We wanted to make sure we're not putting up more barrier for folks. So my big thing, if you don't remember a single thing I talk about today, is really make sure that we listen and ask questions, right? Don't make assumption, right? Look for signs of neglect and self-neglect. That's the second one we have here, is when we are connecting that dot, when we are breaking that ice, look for those signs, right? And when you attend our mandatory reporter training, we attend other training we do is we break out all the different signs, right? Timing, right? Changes on people, right? Look for those signs of like, what is going on? Is this person isolated? Is this person experiencing abuse? Is this person losing their cognitive function? Is this person losing their mobility, and stuff like that? This person's partner just passed away. Is this person out and about, or are they having the quote regular time of grieving process and all that stuff? They are not just further isolating themselves, and is there a sign of suicide ideation? Things like that. Look for those signs and look for those those timing. For us, next one is really examine the resources and reassess what's needed and what's working and what's not working, right? I say this a lot when I was training new staff as a case manager. I always tell my case managers, I say, please, when you are making a referral to folks, for people, you want to call them first. You don't just say, oh, well, I think this is going to help you. Why don't you call this thing, please? And you can sign up for CalAM and you're going to call food bank to get da-da-da-da, you're going to da-da-da. And we don't even think about, wait a minute. This person has high shared costs and they can't do IHSs easy. They can't do blah, 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 blah. So we need to kind of reassess and say, okay, before we make that referral, we could call them, right? And I love, for example, legal assistant to the elderly, for example, right? I love them and I did a great job, right? But do we know, can people drop in or people need to make an appointment? We don't just give them the phone number and say, okay, just call them anytime, right? And a lot of time when people can't hear very well, they call, they don't understand they can't hear the answer machine. You have to press 1 to do the right? Before you know, this is too much work, right? I can't do this, right? So check out the resources and reassess. And people don't just give up, because sometimes when I make a referral and then people will say, well, Ali, I tried that before, it didn't work. Oh, tell me why. Why didn't it work? Well, I called them 3 times, nobody called me back. Oh, can you walk me through what happened? Well, I called them and I left a message and I called them again, and I can't hear them. And so you kind of walk through that process and let people know, oh, okay, well, can I call them with you? We can do a 3-way call. Does that help? Or do you want to meet in person? Stuff like that, right? So kind of think about that when we are supporting folks to break that isolation, right? What support and resources may be available, right, or accessible, to really get regarding increased disability, right? At the MLT, I really want to shout out to people with Martin Luther Tower. They really do a good job. Some of the resident asked, well, we want to have an education on how we're losing people are losing their vision, right? And so what we did is we got a doctor, and actually an eye surgeon, and he came in and he talked about like how aging and vision and blah blah blah, and the resident really appreciate it. So these are the signs to look for. What are the things that you need to do, right? So get people that support, right? And really kind of think about what may be available. Who can come out and do that presentation for our seniors, right? Who can come out and do that presentation? People are losing hearing, right? What may be tools like people can use, right? Yeah. Noticing shame and connecting that support, right? Shame it's a big thing, right? Nobody want to talk about it. I'm so shameful because my son is doing this to me. I'm so shameful. I'm being scammed. I'm shameful, right? So noticing that when you're having conversation with your people, right? And see, wait a minute, is there accessible either culturally and linguistically and support for folks who are feeling this way and that way, so they are not isolated, right? Learn the trauma-informed practices, right? A lot of time that people might have trauma, people may have experiences, and that's why they're doing this and that, right? So really learn those practices and say, okay, how do I support folks when I have this knowledge, right? And I want us to gain knowledge of dynamics of domestic violence, gender-based violence. Gain those knowledge, understand those dynamic when we're supporting folks, right? A lot of time that, just, I'm going to go back to the same example, right? I would hear people say, well, he didn't want to get help. He kept saying that his partner is not beating him up. Nothing's happening, right? Do we understand the pressure that he may be in? He might be gaslit, right? He may be manipulated, thinking that he's the problem, right? I had experienced domestic violence before. I know I know how that felt, right? That I felt like I was the one that go up like, no, I should have done this so I won't get beat up. I should have done that so I won't be sexually assaulted. I should have done that, right? And so I'm not gonna tell the police. This is what's happening to me because it's my fault. I should have done better, right? I should have done better. So a lot of time when we as support people don't understand domestic violence, when we don't understand those dynamic of gender-based violence and human trafficking, for example, we might put people into more harm, right? So understanding those dynamic is really, really helpful. Yeah. Connecting culturally competent grief support for folks, that's really helpful, right? Is there language support for folks? Is there not just language support? Is there support for people with different culture? And what I meant by cultural, I don't mean like which country you're from and stuff like that. It culturally can be disability culture. It could be LGBT culture. It could be people who ride motorcycle culture. You know what I mean? There's a lot of different way people identify their culture, right? So we wanted to really make sure, do we have those support for folks? Reflect on biases and assumption negatively impacting older and adult with disabilities, right? Really reflect on, am I saying this way and I approaching this because of my biases against older adult and adult with disability? Why do I do this and that? We wanted to really reflect, and this item should be on top, right? We wanted to really think about it, right? When we are reflecting on ourselves, we are the best teacher, right? When we learn first, right? We wanted to make sure that we are not having those biases and we are really supporting folks, because at the end of the day, when we're doing this, we're doing this for others. We're not doing this for ourselves, but we benefit when we are reflecting and when we're learning. And I always, when I do support group, when I used to do support group, I always tell the people who come to the groups, like, I'm so grateful, and I am humble to be able to learn their story, and because I'm learning as they learn together. And so when we are supporting folks, we're learning together, we're reflecting. And when people call us out, and I would say, as someone who speaks with an accent, I did this cultural competency training in the past in like early 2000s, stuff like that, right? And so what we did is we did a reflection. We go around the room and tell people, what is your assumption, right? And my big thing was like, I said, this is like 2007, 2008. And so I say, my bad, because I used to think that when people speak with an accent, they needed an interpreter. And they go, oh, Auntie, how can you say that? I say, I know, right? So I check my assumption. Right? I assume people use a white can like me. They are like me. They can't write their own label, right? I assume people need help, right? So we have to check our biases, right? Awareness of the sorry, awareness of diagnosis and victims. Hold on. Victim blaming languages. Yeah. Awareness of the victim blaming languages. When we are working with folks, we want to make sure that we're not using those languages. What did you do? What did you do? Right? That phrase is really triggering for a lot of people. And that will further isolate people. That will further say, you know what? I'm not talking to you when you say that to me, right? I'm not talking to you anymore, right? So a lot of time, when we come in, tell me what happened. Or would you like to share what happened? Right? So we can kind of have a different tone and different vocabulary when we are talking about situation, right? So be aware of that victim blaming language. Sometimes it's not, we don't do it on purpose, we don't know, right? But we wanted to really make sure that we are be aware of how we say things, right? Learn about system oppression, right? Towards those this population, right? Connect accessible support, right? We want to make sure that we're working with other organizations that work with older people and people with disability to support folks. Again, understand that interdependence, that whole idea of interdependence is really helpful, right? And so one thing here I wanted to really bring up is that, we know that what is the percentage? I forgot that, when you have a group of people who live in a congregated setting, for example, in a senior building or in a skilled nursing facility or senior home and places like that, right? There's a big percentage of people talk about how they are feeling isolated. And so what we learn, the big percentage there is one resident bullying another resident. That's a big thing we learned, right? And so we're constantly getting a request. Hey, Ali, can you guys come out and do a bullying a presentation and things like that? And my response is always like, well, I don't want to blame the victim because, no matter what I say to the victim, they didn't do anything wrong, right? The bully is not going to come to the presentation. And I know that people have asked this question before this presentation, that how do we support folks who in the congregated living when they are experiencing isolation and could be experiencing bullying, right? So I really want to make sure that, when we support folks with the bullet point I had talked about, one thing I find it really helpful is creating space for group support. We did one actually recently with one of the building I support, right? We did a women's support group where they get to talk about that those bullying behavior. They get to talk about how their experiences, and everything's confidential. You can sign the form, blah blah blah, and people can every month, and it was really wonderful. It was really wonderful, and when you feel like you have solidarity, you have support, you are not going to feel isolated anymore. So you are not alone, right? You are not alone. So having that support groups is really helpful, either through online or in person. When you are in the skilled nursing, when you have abuse happening or neglect, ombudsman, reach out to them. They are wonderful, wonderful people, right? So reach out to ombudsman and see how they can support your resident in those skilled nursing situation, right? Having more eyes and ears on people, right? Checking in on people, and see, so make sure that they are not feeling alone. Make sure they are not feeling like nobody care about them, right? Increase support. Such as having assessment regarding people who might have increased diagnosis, for example, they might have suicide ideation. How do we support folks who really wanted to end their life? Right. And I'm not here to say, oh, yeah, go ahead, let's just kill ourselves. No, I'm not here to say that. I'm here to say if people are making choices and they want that dignity, what tool do people have? Are we listening to them? Or, we do, one of the MDT, the multidisciplinary team meeting we have with the elder abuse prevention program is our fatality review team. And so we talk about suicide ideation. We talk about people wishing to die, through different methods, right? So, and so when we don't listen to people, when we isolate people, when we don't listen to people, people are going to take that into in their own hand, and they will do it. So regardless of bringing up, suicide or not, people are already in mind. When we were being trained to be on the friendship line, we were told, never be shy of asking people and doing that assessment, because you're not planting seed in their head. If the seed is there, the seed is there already. So don't be afraid to ask people, are you gonna, are you feeling like you want to harm yourself, right? We want to do this assessment in all facility, right? And so I just really wanted to bring those bullet point for people who are living in the congregated setting, right? And the last bullet point I have for this point is that really making sure that if people don't have family around to visit people, see if we can get people connected with different group like Village, Next Village, SF Village. Yeah, wonderful, wonderful. Little Brother, and Open House, really wonderful organization that could support for those efforts, right? So talking about resources, let's talk about resources. Next is my resource thing. And you will be getting this PowerPoint along with the flyer for the friendship line, the flyer, excuse me, the flyer for, that's what I get for having coffee this morning. I'm like having burpees. So you will be getting the flyer for the friendship line and with different languages. You'll be getting the flyer for ADRC Aging and Disability Resource Center in San Francisco, and you'll be getting this PowerPoint. So you can get to see all these different resources. Of course, Dr. Google is really helpful, right? So the first thing I have here is peer and empowerment groups, right? And this is just the groups I put together. They're really wonderful people. Deaf Hope, people who are deaf, and these are empowerment group that you can refer people to and have them join. Community Living Campaign, wonderful people, right? We had them as our panelists last week. You know, they do a lot of neighborhood checking in with people, and they really a lot of peer group. You know, San Francisco Disability Culture Center, they're gonna have a soft, they're gonna have an opening in a couple of weeks, right? So there's a really good space, right? Aging and Disability Resource Center, right? So I just talk about that. You're gonna get the resource, and you can refer people there. Different activity, different support, right? Mental Health Association of San Francisco, wonderful group, and really great place. The last one is really, I like this one a lot because I used to work here, Senior and Disability Action. People from SDA, you know, shout out to you guys. Really wonderful group. I used to be the consumer rights program director in this organization. They do a lot of advocacy work. They do a lot of work together, transit justice group. And if you ever want to get into advocacy group, it's really wonderful place. And it really breaks that isolation for folks who can be involved because you know what? I'm experiencing this and you're experiencing this together and we can do advocacy together. We used to do a lot of phone banking. I'm sure you still do, you know, and I did a lot of different things with them. So it's really a wonderful place to be. Senior center, right? Library, have different activity. Just don't forget your library. It's really important, right? The next thing I have is those crisis lines, those warm lines, really important. Friendship line is one of my love. I volunteer on the friendship line for between 6 and 8 years. I don't remember anymore. And it's really wonderful. Get people connected so they are not isolated. You know, the thing is when we talk about scam prevention, we talk about when people know the scam, they're what 10 times less than likely to be scammed, right? When we are talking about connecting people, they are 10 times less than likely to be isolated, therefore less likely to be in a vulnerable place to be abused, right? So connect people to the friendship line, and there are different languages. Back then, I was the only one that speak Mandarin on the line, right? And now they have people who speak Korean, they speak different languages. Like, oh my God, I'm so jealous. I wish I had time to do volunteering on the friendship line, but it's just such a wonderful service. Mental Health Association also have their peer support line, right? Women Inc. It has their 24-hour crisis line. San Francisco Women Against Rape also have their 24-hour crisis line. Community United Against Violence, CUAV, have their support line for people who are experiencing violence, for queer people who are experiencing violence, right? So we have a lot of different lines. You can find out through the internet. You can find out through us, of course. You can always call DOS, right? So really find out all these different things for folks. It's really a way to break that isolation. Next one, I have the AARP scam victim support groups. There are groups out there, again, checking it out to see if there are way to get people who speak language other than English, right? Do they have language that speak Mandarin? Do they have ASL? Do they have people who have hearing impairment? Do they have, you know, so all these things, we need to really make sure that we have those services for people who are being scammed, right? Domestic violence survivor support group, for example. That's one of my favorite groups to run. I just learned so much and really loving connecting with people, right? The LGBT support group, there's a space at open house, for example. Connect folks to go through those groups. It's really helpful. I think that when people talk to other people, right? The beautiful thing happened right in front of you. It's like, wait a minute, you had that too? I thought I was the only one. Oh my God, right? I always love it to hear that when this organically happen is when people are in the group. And I always push for group because people of course it doesn't work for everyone, of course, right? But when people are in the group, they get to find out that they are not alone. They get to find out they're not alone, and that's a really powerful thing. And sometimes when that happen, changes happen, right? They start to recognize signs. They start recognizing that they have power and they can change things, right? Adult Protective Services, it's a wonderful services. They are voluntary service. They are with the city and county. Akili was here earlier to talk about their service a little bit, and they are wonderful people, social worker that coming out to support folks and connecting those services, for folks who are experiencing abuse, right? And they are not just there to kind of put out the fire. They are there as a support for you. And oftentimes, like, if we have to make 2 or 3 phone calls, then you make 2 or 3 phone calls. That's okay, because your job is there to, as a mandated reporter, your job there is to support folks and then to see what we can do to help people out and get people the support. The last one I have is the Ombudsman's Office. Oftentimes we don't talk about them. We don't have them, their services outlined very clearly, right? And so we wanted to make sure that people can reach out to them, right? Call their office if you suspect an abuse in a skilled nursing, long-term care facilities. Reach out to them. They will send an investigator out. They will send their volunteer out or staff out to investigate, right? There's possible abuse. And here in San Francisco, we have someone, Benson, he has been with the Ombudsman's office for so long and he knows so much. I sometimes, the old information I forget or I wanted to learn, I go to, hey, can you tell me about this and that? And then we can learn a lot, right? So those are good services for us to learn. And with those services, we can get to where we want to be. So before I end the webinar, I wanted to show you one video. This is a video we kind of put together for people who have the tool and who feel empowered to reach out to speak to other people. So Annette, if you could play the video right now, that would be great.
叫 Therese，我可以能夠體會我自己，我能夠做嘢。我呢就係91歲。
저는 67세인 조정영이라고 합니다. 나는 내 자신을 안전하게 보호할 수 있는 능력이 있다고 생각합니다.
Hallo, guten Tag, mein Name ist Petra, ich bin 52 Jahre alt und ich weiß genau, wie ich mich sicher halten kann.
Ako po si Lolita Quintanar, 80 anyos po ako, at alam ko po kung paano ako maging ligtas.
It's Karen McElroy. I'm 70 years old and I have the tools to stay safe.
Thank you so much, participant, for putting the video together for us. I really love this video because it's such an empowering message for us that, we are our authentic self and we have the tool to be safe. So before we end, I just wanted to make a quick announcement. This is a webinar scheduled for our World Elder Abuse Awareness Day, which is June 15. We have lit up the City Hall. Thank you, Assessor. And thank you, Administrator Carmen Chiu, for doing that for us. And with the WIAT activity, we have our walkathon, right? So Annette, if you could put up this screen, it's really wonderful. So the District Attorney's Office Victim Service Unit, Maria had helped us with this year. Thank you so much, Maria, with this walkathon effort. And the winner of the walkathon is Patty Myers. She is a IOA staff. Thank you and congratulations, Patty. And she's our champion. It's really wonderful to be competing. If you all wanted to join us next year, please do. It gets really heated. It's really funny. We were watching and walking, so it gets really heated. So the total number, oh my goodness, I have to translate the number to English is 2,622.9. Okay, 2,628,294 steps, total group step. And that's a lot. That's a lot. 2 million some steps. That's a lot as a group. So it's a wonderful thing to do. It's a really good, how do you say that, encouragement for us to kind of let us, each others know that, we're walking against elder abuse, against abuse, against dependent adult, right? We're walking together. It's a fun way to encourage each other. So please join us next year and just have some fun while we're doing our work, right? Next slide is our thank you slide. Thank you so much for being here. I wanted to leave room for questioning and answering. And the thing I wanted to say is I so appreciate you all doing the work you do. Without you all, we can't be doing the work as elder abuse prevention program, right? We are a village and we are doing this together. This is our contact information. If you want to get on our newsletter list, if you want to get on our list to join our public multidisciplinary team meetings, please email us. And if you need support and do a consultation, email me. Let's chat. Let's chat. So that's my information for the webinar. We have about 15 minutes for Q&A. So hopefully we have some questions.
Hi, Allie. Thank you. That was an excellent presentation. This is Sarah. Okay, we do have a couple questions in the Q&A. If anyone has any questions or comments or anything they would like to add, please feel free to put them in the Q&A and we will go over them. So actually, someone did ask if they can get the recording. What is your...
Absolutely. Yes. Yeah.
Great.
We have to find out how to share it because it's a big file. So we have to figure it out. So whoever want the recording, please either reach out to Sarah or reach out to us. Maybe reach out to us so it's not like a lot of email for Sarah. Yeah.
Either way is fine.
Yeah. Okay.
And then someone also asked if the slides will be sent out, and the answer to that is yes. Okay, so non-administrative questions. How can I help my client who is clearly showing signs of physical abuse by her husband? I should add that he never leaves her side, so speaking privately with her is quite difficult. I once attempted to speak to her in the ladies' room, but he was pounding on the door, screaming to her to leave the bathroom.
Yeah. And Sarah knows this already. Like we do a training specifically on domestic violence with older adults, and then we're going to do one with domestic violence against people with disability and deaf community in October, I believe. And that's one of the big things, isolation, right? And people think, well, that's not isolating. They're always with them. Well, that's one of the tools, right? They're with the person and you have no opportunity to talk about abuse. And I got that a lot when I was on the crisis line, right? So we wanted to make sure we make safety plan, right? Either to say, okay, well, you go down to the corner store and get your fruit and I'll meet you there. Or, or we can make appointment for like doctor's appointment. And the doctor will say, well, this is a woman. For example, the survivor is a woman, right? And the doctor, well, this is the woman examination. So you do it in the space where, quote, maybe that just take your client, right? This is a heterosexual relationship, right? So he can't be in the room, right? In the ladies' room, for example, like, yeah, he's pounding the door and she's feeling, sweat. So it's really hard. I don't have a golden answer for that, but find opportunity and make those safety plan, right? Because he's find out that she's talking to others about the abuse that could put her in more danger, right? So keep that in mind that we don't want to put people in more dangerous situation when we're trying to support them. So be creative. And again, I'm happy to chat about this. And you can call Women Inc. And I think it's a 864-4722 number. You can call different domestic violence an agency, and they could kind of walk you through those safety plan. Yeah.
Great. Thank you, Allie. And then someone just asked for your email address, so I'm going to put it in the chat. And let's see, how to help a lonely person, a victim of continued financial scams who intermittently understands the scam but continues to participate with the scammers.
This is a big question, and this is a question we kind of try to coordinate in our multidisciplinary team a lot. So different factors, right? Say someone who's being scammed, right? Gets scammed, and they kind of understand. Sometimes they don't understand, and they continue to send money, right? And the big factor is, yeah, you said it. They are lonely, right? And this the scammer call that may be the only call they get in a week. That may be the only call, right? So how do we break that, right? So first, break that isolation, right? Get them more support, blah, 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 right? But they might have cognitive impairment, through aging and different things. So get them the support. When was the last time they see their PCP, the primary care physician? When was the last time they, have people visit them, right? And the last thing, and not the only thing, is really get them connected again with support group if they are able and willing to get those support group. The AARP the support group they have it online, and people can kind of go to it, right? And there may be other support group out there that we can research and find a support group for them, and having other family, and so once they're in the support group, they go, yeah, this guy, scam me, da 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 da, and they go, oh, yeah, I had the same exact situation. They text me and blah blah blah, right? So getting people connected is really important. And even with that, people still would get scammed. And you know why people are scammed over and over again? Because their name are being sold in their list. So that's why they are more vulnerable, because their information being sold already. So, and that's a really scary thing. It's really hard to fight that. Getting support to change your phone number and this and that. It's a big process. Yeah. So it's just not a simple answer for that, but yeah.
Thank you.
Mhm.
I have a resident who is getting abused by her daughter who has a mental disability. How do I navigate? What next steps do I take if APS is already involved but hasn't made progress in the case?
Yeah. And see, that's a big thing, right? First of all, is your resident open to talk about being abused by her daughter? How open is your resident talking about it? And what does the resident wants to do? Right. And when we talk about domestic violence, this is a form of domestic violence, even though they're not an intimate relationship, right? But they are somewhat intimate because this is the daughter, right? So people takes a long time to break that relationship pattern, right? So, for us to really coaching, as a mother, I'm a mother. I have two grown adult children, right? Do I want to tell people? Do I want to admit to, someone I don't know very well? You may be a really good person and nice person, right? But I don't know you. You're not my friend. I don't want to tell you my son is doing this to me, right? So it's a shame, right? So there's a lot of things that in your client's head that, okay, how do we support her? And she's got so my first thing is to build that rapport with her, to say, hey, how are you feeling about this? And do you feel safe? What would you like to do? Ask her and work out that safety plan with her. And so what I used to do when I'm on the crisis line is, if when we determine this person's ready to kind of leave and break this relationship, is okay, so what are the step-by-step thing we need to do? Do we need to kick your daughter out, or do we need to separate this way? Recently we had one situation where the mother is being abused by the daughter, and so the mother actually worked it out with her son, and the son actually moved the mother to his building and kind of get away. Basically, the daughter doesn't know which unit the mother lives in. And so that's one way for the mother to get some relief. And the son is support. And so now the daughter is calling APS and saying that the son is kidnapped and all that stuff, right? So there's different thing. But the first thing is really ask the mother, what she like to do. I'm sorry, I don't have short answers. So I hope this is helpful.
Are there any third-party services for POAs if somebody needs assistance with managing their finances, but they don't have family or friends to act as their agent?
Yes. So and depends if well, let me step back. So if people wanted to get a representative payee, they are actually a nonprofit organization that could do that. But if the person is receiving federal assistance, that's a different process, right? So POA, we can see if we can get fiduciary to help out, or we can get reach out to the county. You can call DOS and they could give you resources on that.
Great. What are the best practices to connect clients with services when they refuse APS help, knowing that client is actively engaging in scams and or are isolated?
Yeah, see, again, that is so hard. I think that, when they don't want help from APS, from social worker, from you, right? That is one of the most difficult part, right? Again, you can help them make the report to IC3, the number 3. That's the Internet Crime oh my God, I forgot the whole word thing. And if Glenn is in the webinar, please put it in the chat or the Q&A. So IC3 is a place you can report and get the FBI on it. Making report. I think that one thing is making report and again continue to connect them to support group if they are willing to accept those.
Great. Thank you.
Yes.
That is the end of the questions for right now, unless anyone has anything else to put into the Q&A. We can give it a minute to see, but while we're waiting, Allie, thank you so much for an incredible presentation, and thank you and your team for all of your hard work all the time and educating all of us. And Annette, thank you for running the slides and the videos and everything.
Thank you.
Excellent. So yeah, I think